We want to make sure that every provider has the ability to protect itself and its patients, and not have to worry about budgets or funding to do the right thing. Those words from a leading healthcare cybersecurity expert are music to the ears of hospital and health system leaders whose systems have been the target of criminal cybersecurity intrusions, both attempted and successful. So, how can providers achieve this higher level of safety from cyber attacks? Stay tuned. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association, and a podcast that you've rewarded with 100,000 listens in 2022. Thanks for your support. I'm Tom Hedderly with AHA Communications. Ed Gaudet is the founder of Censinet, one of AHA's carefully vetted preferred cybersecurity providers. Gaudet is an expert of many years in the field. In addition to leading his company, he is active on a government task force established by the Cybersecurity Information Sharing Act of 2015, whose mission it is to improve cybersecurity in healthcare. Along the way, Ed crossed paths with John Riggi, AHA's National Advisor for Cybersecurity and Risk, who was also serving on the task force representing the nation's hospitals and health systems. In this podcast, John and Ed discuss how Censinet's approach to cybersecurity can help members, regardless of size or budget, to reduce the cyber risks that threaten patient safety and care delivery. Let's kick it over to John.
Thank you, Tom. Hello, everyone. This is John Riggi, your National Advisor for Cybersecurity and Risk. Thanks for joining us again for another Advancing Health podcast special series, Frontline Perspective. In this series, we focus on national cyber and risk issues, and we feature highly accomplished leaders from the healthcare field, cybersecurity industry, and government. They provide us with their frontline perspective in the never-ending battle against serious cyber threats we all face in the healthcare field and as a nation. Today, I have the pleasure and privilege to have as my guest, my friend and colleague, Ed Gaudet. Ed is the CEO and founder of Censinet, which is a AHA vetted and preferred cybersecurity provider. Ed has more than 25 years of software experience across various product, marketing, and sales leadership roles. Ed was the chief marketing officer at Imprivata, where he created Imprivata Cortex, a best-in-class cloud-based clinical communications platform. Prior to Imprivata, Ed was the senior vice president of corporate development for Liquid Machines. Ed holds several patents and is an industry speaker on the topics of leadership, healthcare, and regulatory compliance. As impressive as all of those accomplishments are, Ed somehow finds time to regularly not only volunteer, but lead projects under the joint HHS and healthcare sector 405D task force. No, that cool moniker is not a reference to some secret government private sector operation. It actually refers to the section of the federal statute, the Cybersecurity Information Sharing Act of 2015, which created this legislatively mandated collaborative task force, whose mission is to improve cybersecurity in healthcare, and where I first met Ed. So Ed, thanks again for your dedication and spending your personal time to work on the 405D task force and for the assistance in the development of the healthcare industry cybersecurity practices. Could you describe for us in brief what the HICP, or as others refer to it as the hiccup, what it is and how it's structured?
Yeah, great. Well, thanks, John. And it's a pleasure and an honor being here today with you and talking about Hiccup and the exciting offer that we're putting together with the AHA. So, as you're familiar with Hiccup, it's a unique private and public partnership where we're pulling industry together with government leaders and bringing a set of cybersecurity practices to healthcare providers that enables large and small providers to consume, to manage, to use the best-in-class cybersecurity practices to protect not only their organization, but their patients, the safety of their patients and the data of their patients and overall care operations. So with the 405D program and task group, we've collaborated on a set of documents that provide that level of guidance and awareness to small, medium, and large size organizations, by which they can take that and actually implement those practices internally to, again, manage and reduce threats to their operations, patient safety, as well as patient data.
Thanks, Ed. I think you mentioned a couple of key points, right? Cybersecurity is not just about the protection of the privacy and security of data. It's really about the protection of patients. And as we've seen, unfortunately, especially over the past several years, these high impact ransomware attacks, which disrupt and delay healthcare delivery and risk patient safety. Clearly, the HICCUP framework, which is based on large part on NIST, will certainly go a long way in helping secure healthcare delivery. So, in general, what are some of the important distinctions between HICCUP and NIST? In other words, why not just use the NIST cybersecurity framework as the standard framework for healthcare?
Yeah, it's great point. Well, first of all, HICCUP is really designed for a number of different organizational sizes and types. And NIST is, first of all, it's a cybersecurity, it is a framework, whereas HICCUP is not a framework. HICCUP is a prescriptive set of practices, 10 practices to be exact, that target 5 specific threats. So it's highly prescriptive in its design and implementation. NIST CSF is much broader. For example, there's over 51 subcategories in the NIST CSF framework that actually aren't even spoken to within HICCUP. HICCUP does leverage NIST CSF, but only a portion of it. And so when you think about NIST CSF, it's designed for the most complex, sophisticated organizations that have multiple sites, they have multiple dimensions of their overall business and organization. They have the appropriate level of investments and resources to manage to a framework the size of the NIST CSF and do it in an efficient and effective way. Where HICCUP really excels is for those organizations, small to medium. Obviously, it works with large as well, but those smaller to medium sized organizations that may be struggling with resources. You've got your typical rural hospital. The rural hospitals are the foundation or the backbone of our health system, and yet they struggle with implementing the simplest of controls when it comes to cybersecurity, based on what they have to deal with every day and based on the limited resources they have. So providing them a level of best practices that's easy to implement, easy to follow, easy to manage to, and also easy to track progress over time is really important and helps those smaller organizations manage at a level that enables them to reduce those threats that otherwise, they would either have to just accept and deal with after the fact or outsource that to maybe a third-party organization.
Yeah, thanks for that explanation, Ed. And really, bottom line is NIST CSF, as good as it is not healthcare specific. HICCUP is healthcare specific. So beyond the clear inherent cyber risk reduction value of implementing HICCUP, adherence to HICCUP has other risk reduction value, specifically in terms of regulatory risk reduction. And what I mean is, in January 2021, as the result of AHA's testimony before the Senate Homeland Security Committee, and in conjunction with the Healthcare Sector Coordinating Council and other prominent voices in healthcare, HR 7898 was signed into law. This law provides regulatory relief for HIPAA-covered entities and business associates if they become a victim of a cyber breach and if they can demonstrate the use of recognized cybersecurity practices. The two specifically cited cybersecurity practices in the statute are NIST and HICCUP. And the regulatory relief is significant. Expedited favorable termination of HHS Office of Civil Rights audit and reduced penalties and fines. So Ed, tell us what your tool is that you're offering to healthcare sector at large for free, and how does that relate to HICCUP?
Yeah, thanks, John. And that law, the public law 116-321, is a real incentive for healthcare organizations to obviously implement HICCUP or NIST as they move forward with their cybersecurity programs and risk programs. And so what we've done is we've taken a look at what's available with Hiccup. We obviously worked personally with the task groups that put Hiccup together, very familiar with the content, which is very comprehensive, but it's a series of documents, very static, and we were able to pull that into our platform. Our platform is called Censinet Risk Ops, and it's a third-party risk management, enterprise risk management platform. And we've leveraged the automation to drive management, implementation, trending, reporting, and overall baselining and benchmarking of progress to meet the standards associated with the practice of Hiccup and enable those organizations to support the public law and the regulatory relief that's available.
Thanks, Ed. So I have to ask, why are you offering this for free to the healthcare sector?
It's a great question, John. What I love about healthcare is the shared mission that we have with customers. Everyone wants better and safer care. And so from the beginning, we began our journey with a vision that we want to enable and help our customers take the risk out of healthcare, whether it's cybersecurity risk or other types of risk. We have a number of products and value-based solutions that we provide to healthcare providers today. And so based on the work we did with Hiccup and based on the need for a solution like Hiccup that automates that process of managing and reporting on progress and maturity and compliance to Hiccup, we felt like there was an opportunity to give something back to the community. We've been giving our time back, as you mentioned earlier. This really, raised the bar, if you will. And for other vendors in the community that also service healthcare, we obviously do a lot of work with customers, and they pay us for that work and that value. This felt like the right thing to do, given where we are as an industry. And this notion of stronger together is not only a professional mission, but it's also a personal mission. And I'll tell you why. It's one thing 10 years ago, if you lost data in healthcare, you may get a fine, you may be embarrassed, you may get a public press release denouncing your lax practices, et cetera, but nobody lost their life or care wasn't diverted from one site to another site because it was a ransomware in progress. And if your mother, father, sister, brother, aunt, uncle, cousin is hooked up to a machine or in one of those ambulances on the way to the hospital, and that system is attacked and that ambulance gets diverted or that machine gets turned off because of the attack, that becomes personal. And so for us, we want to make sure that every provider has the ability to protect itself and its patients and not have to worry about budgets, not have to worry about coming up with funding to do the right thing in that regard.
Thanks for those noble sentiments there. And you're absolutely correct. Whether you are a vendor, a healthcare provider, government agency employee, we all depend upon the availability of our local hospitals and emergency departments and healthcare providers. And it's become pretty clear with the high impact ransomware attacks we've suffered the past several years that, as you said, cyber risk poses a risk to patient safety in healthcare delivery. In fact, Ed, I want to just briefly comment on some other work you've done for the sector regarding your joint report with Ponemon Institute, which was a survey of technical leaders in healthcare who opine that high impact ransomware attacks, which contributed to negative patient outcomes, including death. So pretty startling data that you collected there with Ponemon Institute, subsequently to be validated 2 weeks later when the Cybersecurity Infrastructure Security Agency published their report, which showed, based on CDC data, which showed a strong positive correlation between high impact ransomware attacks on hospitals and regionally increased deaths. So very, very significant work there, and really just highlights the problem tremendously. So, moving on, because of your status as a vetted and recommended AHA preferred cybersecurity provider, you're offering members of the AHA another important feature of this tool for free. Could you tell us about that and what that is and why it's important?
Yeah, that's right, John. So, in addition to getting the full support around hiccup assessments and reporting and dashboards, we're also providing your HA membership the ability to actually see how they're doing relative to their peers. How are they doing in terms of their coverage to the 10 practices against the 5 threats? How are they doing in terms of their overall ability to remediate the gaps that they may have identified in resources or policies or overall procedures, and really help them with overall decision making as it relates to investments around cybersecurity.
Thanks, Ed. So, Ed, as you know, myself and the members are very skeptical when a cybersecurity vendor comes to us with a free offer. And the members should know that regardless of the work we are doing together, I grilled Ed on any hidden costs of this program and what the catch might be. Ed, are there any long-term costs or time limit to these free tools you're offering? And can we download our benchmarking results?
Yeah, so you have to be an HA member, but it's free. It's freely available. There are no strings attached. We're not going to try to bait and switch you, like I've seen in the past. I'm not a big fan of that. So yeah, keep us honest. Try it out. There's an easy way to get more information. You can go to the website www.censinet.com/HICP, and that'll direct you to a page about the HICP program, as well as the ability to fill out a form to request basically a demo of the capabilities. And at that point, we can actually onboard you into the application. It's a fairly simple set of steps to get you started, and you can be started within a day or less.
Thanks, Ed. And thanks for all the work you're doing in the healthcare sector, providing and lending your expertise and experience. And of course, thank you for the free offer, which I think will be very valuable for our members, both to improve their cybersecurity posture and then in the unfortunate event, if they do become victims of cyber attack, to help demonstrate to the regulators that they were in fact adhering to the hiccup framework. Thank you, Ed, for what you and our other commercial partners are doing to help defend healthcare by sharing your knowledge, expertise, and capabilities. And thanks to all our healthcare listeners for what you do and have done to care for our patients and keep our communities safe and healthy. On behalf of the American Hospital Association, this has been John Riggi, your National Advisor for Cybersecurity and Risk. Stay safe, everyone.
You've been listening to Advancing Health, a podcast that you've rewarded with 100,000 listens in 2022. Thanks for your support, and we'll keep working to bring you content that makes a difference.